Hello, I'm Debbie Clark, and welcome to Mature Matters. We have a very special guest today who's going to be talking about a sensitive subject, but it's also one that millions of Americans, men and women, suffer in silence. It's urinary incontinence or leaking. We want to thank Melissa Landry for coming in and sharing her expertise on this subject. She is a specialist. She works at Beaumont Farmington Hills. Welcome, Melissa. We thank you so much for taking the time to come in and talking to us about this very sensitive subject.
Thank you.
Was just wondering if you'd let me know a little bit about your experience, or our audience, I should say.
Well, I've been a practicing physical therapist for just over 4 years now. I graduated with my Doctor of Physical Therapy from Wayne State University, and I've been with Beaumont Farmington Hills Redford Clinic now for about 3 years, and seen primarily outpatient orthopedic patients.
Very nice. Well, again, thank you for coming in. I think the big question is, what is urinary incontinence?
So urinary incontinence is any involuntary leakage of urine. So there's many different types. The most common type that we see is stress urinary incontinence. So that's any involuntary leakage with effort or exertion, such as, coughing, sneezing, laughing, running, dancing, jumping. So anything that increases the abdominal pressure. The next one would be urge urinary incontinence, and that's any involuntary leakage with that strong desire to urinate. So, if someone gets that message, I need to get to the bathroom, but they can't quite make it in time, and they end up with some leakage. And then the last type is mixed urinary incontinence, and that's just a mixture of both stress and urge urinary incontinence symptoms.
What could be some causes of urinary leakage?
Well, the main cause would be, it's due to underactive pelvic floor muscles. So, when the muscles aren't able to contract when they should contract, or as strong as they should. Some common situations would be, during pregnancy or after childbirth, with chronic constipation from, patients having to strain those muscles, as well as with chronic coughing, asthma, smoking, so that coughing, that increased abdominal pressure. If patients have gone through some pelvic surgery and some supportive ligaments have been removed. Also high impact exercises, female athletes ages 18 to 25, there's a high prevalence of urinary incontinence with them, the stress urinary incontinence, as well as with aging, just with that muscle loss.
So Melissa, what can a person do, like myself, if we're experiencing these type of symptoms?
Well, the thing is there's a lot of people, like you mentioned, that do suffer from urinary incontinence, and most people think that it's just part of the normal aging process. There's commercials advertising different, protection, apparel, and just everyone just feels like they just have to deal with it. So over the years, physical therapy has been definitely coming around more and developing more into the women's health or urinary incontinence programs. So the biggest thing would be to just go to your doctor and bring up those symptoms, and whether it be, we see patients that are being referred by their primary care physicians, OBGYNs, as well as urologists. So it just takes a referral from your physician, and the pelvic floor rehabilitation program is done by a physical therapist. So if your insurance covers physical therapy, then the program should be covered for you.
So you said a referral, that would be a prescription?
That's right.
From the doctor?
Yep.
And insurances, most people, like you said, if it covers physical therapy, then that would be under the physical therapy umbrella.
That's correct.
Yes.
Yep.
And if those who are just wondering, you might want to call your provider and just double check that it does cover physical therapy if you're not sure.
Correct.
If I'm a patient coming in to see you, Melissa, what can I expect on day one?
Well, on
Can you kind of walk me through what you do for these people?
Yeah. So on day 1 is the initial evaluation. So you'll have some paperwork to fill out, and then we'll go over your medical history, your medication, your surgical history, and definitely any symptoms that you've been experiencing. From there, we'll start into, looking at your lumbar spine, your hips, your pelvis, just to see if any range of motion, flexibility, or strength issues are contributing to your symptoms. And then from there, we typically do an internal assessment, if needed, and also with the consent of the patient. So the pelvic floor muscles are best access through the vagina. So, the internal assessment gives us the best reading of your muscle contractions, as well as your ability to actively relax those muscles and your muscle endurance. And, as well as checking for any tissue abnormalities due to scar tissue or anything like that. And again, that's with the consent of the patient.
Sure.
And sometimes it's not always needed. So that's what you can expect from the eval. So, and then from there, you're given a bladder diary to take home, okay, and just about 2 or 3 days worth of, keeping track of your fluid intake, how many times you're urinating throughout the day, if there's been any leakages, and, what were the circumstances of them, what activity you were doing, and how much was there, just a couple dribbles, or was it more of a gush? Okay, and then from there, then you'll bring it back, that next treatment visit. We'll go over that, see if there's any patterns that we see as far as, if we can suggest any dietary changes for you, some foods we eat, some things that we drink can affect the bladder and how frequently we urinate, so giving some tips on that. As well as just education on behavior modification, toileting habits, and just some little tidbits for your daily routine.
Yes.
And then as far as the treatment from there on, patients are typically scheduled 1 to 2 times a week for approximately 45-minute sessions, mostly working on muscle re-education, and the treatment itself is tailored to what has been found in the evaluation, so specific to that patient.
Right. So it's not just about contracting those muscles down below. It sounds like there's a lot more to it.
And definitely. I mean, if there's, the muscle loss, the muscle re-education, most patients don't know how to properly, contract their pelvic floor muscles, or at least isolate them without using other surrounding muscle groups.
Right. So if I were to come to you or anybody in our audience after they get their prescription, is any physical therapist able to do this treatment?
Well, the pelvic floor rehabilitation, it's not something that's instructed in an entry-level degree program. So upon graduating, I was not able to treat patients with pelvic floor conditions. It's something that you have to go and be certified, or, there's some certification programs, and there's also some just continuing ed programs, so continuing education programs. So you definitely want to do your research and make sure you're going to a facility where the therapist has been trained in pelvic floor rehabilitation. Most courses do have extensive lab work and the education process, and clinicians should be tested after the course, both on their skills as well as their knowledge.
Right, so they need to specifically ask when they call a physical therapy clinic is, do you have a therapist that specializes in pelvic floor rehab?
Yes.
Yes, and I would think that most of the associates or the receptionists would know what they were asking about. The big thing I hear from my parents, with them being seniors, is I'm not going to drink water, because if I drink water, then I'm going to have to go more. Is there some truth to that? Should they be drinking more water? What would you instruct a patient, I guess I would say?
You definitely want to make sure you're getting, the recommended daily allowance of water, and it varies patient to patient, based on, other medical conditions that could interfere with that. Definitely, the more we drink, the more we're going to need to use the bathroom. What we need to do though is, like I said, there's certain things that we drink, certain things that we eat that can affect the frequency that we go. It can irritate the lining of the bladder, so we need that water in order to dilute those items that we have consumed, in order to, if we dilute it, we don't go as often.
Right.
When that bladder wall becomes irritated, then we get that sensation that we need to go. So for example, a common thing, people may find that drinking coffee, they may use the restroom quite frequently. So that is an irritant to the bladder lining, so sending that message that you need to empty your bladder. So not saying that you have to completely eliminate coffee, but maybe cutting down on the amount that you're drinking a day, or making sure that you're diluting it with water. Now on the other side, if you don't drink any water at all, urine can irritate the bladder wall as well. So we need that water in order to dilute that. So by not drinking anything at all, you're still going to get that irritation, causing you to void more frequently.
Right, and it can probably lead to some urinary tract infections as well if you're not hydrating and flushing out that whole system. Is there any two key points, or a key point that you could tell our audience that what would prompt them to go to the doctor? What key things can we educate them about that they don't have to suffer in silence anymore?
I'd say, definitely don't wait until these symptoms affect your quality of life. Urinary incontinence is not normal. You should get it addressed as soon as possible. That would be the biggest thing. And also, just making sure that they're drinking that proper amount of water per day. Yeah.
Very, very good advice. Well, Melissa, I want to thank you so much for your time on coming in and talking about this sensitive subject. Most people don't want to talk about this subject because it is embarrassing. But I think if you know that you're not alone, and if you explain your symptoms to the doctor, get a referral or a prescription, specialists like Melissa are out there and they can help you to improve the quality of your life. At this time, we'd like to thank you for tuning in, and we'll see you next time.